Namaste everyone, welcome to Need Guidance. Just chill, relax yourself. The topic is hip bone. Mainly, the main aspect is we are dealing with the parts. Second is anatomical position and side determination. Basically, we are having a quick recap on these points. This one is a part, anatomical position, and side determination. Basically, hip bone is the fusion of three bones. Those are ilium, ischium, and pubis. So before uh, continue with the presentation, I want to say one thing that you might be thinking that how can the bone be discussed without the bone? Means osteology, how it can be discussed without having a bone. So before you are holding a bone in your hand, you should be having knowledge about that bone. Means you can't without having knowledge. If you hold the bone, we can't gain the full knowledge of that bone. So basically, I am focusing on the theoretical aspect so that if we are thorough with these points, we can easily determine the anatomical position and side determination. Hip bone is a fusion of ilium, ischium, and pubis. It consists of three parts. One is the upper expanded part, that is the ilium. Middle constricted part is the cup-shaped acetabulum, and the lower expanded part, that is obturator foramen. Ilium, upper expanded is the ilium, and the middle is the acetabulum, and lower part is the obturator foramen. These are the parts of the hip bone. Next, continuing with the anatomical position and side determination. So that you should hold the hip bone in such a way that acetabulum should be lateral, that where the femur articulates, that portion that is called the acetabulum, it should be lateral. Obturator foramen should be below the acetabulum. And the flat ilium should be upward, and thin pubis that should be anteromedial, and thick ischium should be posterior inferior. These are the anatomical position. These are the points that should be remembered while holding the bone in anatomical position. I will try to put, and another one is the coronal plane. So we have here two regions, that is one is the pubic tubercle and anterior superiliac spine. These both should be in coronal plane for side determination. And next is the ischial tuberosity. This should be in the lowest position. I will try to put in the diagram so that parts and relations can be easily remembered. Yeah, here is the hip bone. Upper expanded part is there are three parts. One is the upper expanded, that is called the ilium, and the middle constricted part is the acetabulum, and the lower expanded part is called is the obturator foramen. These are the three parts. Dealing with the anatomical position and side determination, acetabulum should be lateral. The blue colored one you see them, that is the acetabulum, that should be lateral, and obturator foramen should be below the acetabulum. So we should hold the bone in such a way that acetabulum is lateral and obturator foramen is below the acetabulum, and ilium should be upward. These are the three uh, relations for side determination. And we have the lower, another one is the coronal plane. Pubic tubercle and anterior superiliac spine, they should be in coronal plane, and ischial tuberosity should be in the lowest position. So there we have completed with parts and parts and anatomical position and side determination. Hope it's well explained, I think. Thank you. Good luck for your future.